My name is Dr. Miles, and I've spent 13 years in emergency medicine. In that time, I have watched people lose their independence, not to cancer, not to heart disease, not to stroke, but to something nobody warned them about. Something quiet, something slow, something that was happening inside their body for years before anyone noticed. Muscle loss. And before you tell yourself this video is not for you, that you are still active, still mobile, still fine, I want you to stay with me for the next few minutes. Because the people I see in my emergency department, who can no longer get off the floor after a fall, who cannot climb into an ambulance unassisted, who are frightened to walk to their own bathroom alone at night, almost none of them saw it coming either. They thought they were just getting older. They were not just getting older. They were losing 3 specific muscle groups that are the biological foundation of human independence. And by the time most people realize what is happening, they have already lost years they cannot get back. Here's what those 3 muscles are, what losing them actually looks like in real life, and exactly what you can do about it, starting today, at home, with no equipment. First, why this is not about fitness. I need to say this clearly because it changes everything about how you should think about what follows. This is not a fitness video. I am not here to talk to you about weight loss or six-pack muscles or gym performance. I do not care about any of that in this context. I care about whether you will be able to stand up from a chair at 82 without using your arms. I care about whether you will be able to catch yourself when you trip on a pavement at 75. I care about whether you will be living in your own home at 85 or in a care facility, because your body can no longer keep up with the basic demands of daily life. Here's a statistic I give every patient who tells me they will think about exercise later. If you fall and fracture your hip after the age of 70, there is a 20 to 30% chance you will be dead within 12 months. Not from the fracture itself, from the cascade of events it triggers. The hospitalization, the muscle loss that follows bed rest, the pneumonia, the blood clots, the decline that compounds itself until the body cannot recover. One fall, one fracture, a 1 in 3 chance it ends your story early. And the muscles I'm about to describe to you are the ones that prevent that fall in the first place. Muscle. Number 1, your quadriceps, the muscle that decides your future. The quadriceps sit at the front of your thigh. They are the largest, most powerful muscle group in your lower body. And they are responsible for one single movement that tells me almost everything I need to know about a patient's long-term prognosis. Standing up from a chair. That is it. That is the test. Not a treadmill, not a weight rack, a chair. I want you to try something right now. Sit down on a standard chair. Cross your arms over your chest so your hands are not available. Now, stand up. 5 times. Controlled. Without using your arms at all. If that feels easy, your quadriceps are doing their job. If you found yourself leaning forward heavily, rocking to generate momentum, or reaching for the armrest, your quadriceps are already weaker than they should be. And if you could not do it at all without your arms, this muscle has been fading for longer than you realize. In my emergency department, I see the endpoint of neglected quadriceps constantly. Patients who cannot rise from a hospital bed without 2 nurses assisting them. Patients who are frightened to use the toilet in the night because they are not sure they can get back up. Patients whose world has shrunk to the distance between their chair and their bed because standing feels like a risk. That is not age. That is a muscle that was never asked to work hard enough, for long enough, for enough years. The fix is straightforward. Slow, controlled, sit-to-stands from a chair. 10 repetitions, 2 to 3 sets. No equipment, no gym, just a chair, and the willingness to show up for yourself every single day. That muscle responds faster than almost any other in the body. I have seen patients transform their standing strength in 6 to 8 weeks with nothing more than this. Muscle number 2, your glutes, the muscle nobody talks about. Most people have never thought seriously about their gluteal muscles. They think about them in terms of appearance, perhaps, not in terms of survival. Here is the clinical reality. Your glutes are the primary stabilizers of your pelvis and your lower back. Every time you take a step, your glutes fire to keep your pelvis level, your spine aligned, and your body balanced over a single leg for a fraction of a second. That happens thousands of times every day when you walk. When the glutes weaken, and they weaken faster than almost any muscle, when we become sedentary, the pelvis begins to tilt. The lower back compensates. The knees compensate. The walking pattern changes. Steps become shorter. The pace slows. Confidence erodes. I had a patient, a 69-year-old woman, former teacher, sharp and capable, who came to me convinced she had a hip problem. She was walking with a subtle but visible lean to one side. Not painful, just different. Her imaging was normal. What she had was significant gluteal weakness on her right side, causing her body to compensate with every single step she took. 6 months of targeted glute work, and she walked out of my follow-up appointment without the lean. Her words to me were, "I feel like I got 5 years back." The test is simple. Lie on your side, keeping your hips stacked. Lift your top leg to about 45 degrees. Hold for 2 seconds, lower slowly. 20 repetitions. If that burns intensely after 10, your glutes need work. If you feel it more in your lower back than your hip, same answer. Muscle number 3. Your calves, the muscles that keep you on the ground. Your calf muscles are your body's anti-fall system. They control your balance when you are slightly off-center, the micro corrections that happen dozens of times per minute when you are simply standing still. They control the push-off phase of walking, which determines your stride length, your walking speed, and your ability to clear obstacles, like curbs and uneven ground. Walking speed in older adults is one of the most powerful predictors of mortality that exists in medicine. More predictive than many blood tests. More predictive than cholesterol. A slow walking pace is your body telling us, in language we can measure, that its reserves are shrinking. And the calf muscles are a primary driver of that walking speed. Here's your test. Stand near a wall or kitchen counter for balance. Rise up onto the toes of one foot. Hold for 2 seconds. Lower slowly. Can you do 10 repetitions on a single leg with control? If that feels unstable, if you are gripping the wall hard, if you cannot manage 10, your calves are not doing their job fully. The exercise is identical to the test. Single leg calf raises, holding a surface for safety, 10 to 15 repetitions daily. That is genuinely all it takes to begin rebuilding this muscle. The honest conversation. Here is what I tell every patient who sits in front of me and says they will start working on this soon. Soon is not a strategy. Soon is how people end up in my department. The window where this work is most effective, where the muscle responds fastest, where the investment pays back the highest returns, is your 50s, 60s, and early 70s. Every year you wait, the rebuild takes longer and the starting point gets lower. Aging is inevitable. Frailty is not. Those are not the same thing, and I need you to understand the difference. The people I have watched maintain their independence deep into their 80s and 90s are not people who were born lucky. They are people who understood early that their muscles were not cosmetic. They were structural. They were the architecture that everything else, their confidence, their social life, their dignity, their years, was built on. You still have time to build that architecture, but you have to start. If this video gave you something worth keeping, please subscribe to this channel. Dr. Miles and his team are building something here, real medicine, explained clearly, for people who want to take control of their health before they need emergency care. Every subscriber helps us reach one more person in time. Hit subscribe. It costs you nothing, and it means everything for this channel's growth. Thanks for watching. I'll see you in the next video.